Hello, everybody. My name is Kellen Ingram, and today I'm talking to you about how I would like to be a healthcare administrator one day. So, a healthcare administration position relies basically on helping people. To put it simply, you run the day-to-day of a hospital, and as boring and paperwork bound as that sounds, it's a very important job. The main reasons why this position is important to me is you help people, as cliche as that sounds, but you help people. Another one of the big reasons why this is such an important field to me is when I was always growing up, I was fortunate enough to live near the man who invented the Crest White strips. I don't know if you're familiar with them or not, but he told me when I was probably 10 to get into a field where people are going to constantly need what you provide, whether that be hygiene accessories like him or healthcare, which everybody needed, has probably been around it before, whether they think they have or not. The field has so much room to grow. There's no sign of it ever slowing down, halting. The only signs of it are to grow, and that's exciting. So obviously, getting into a field like that, you have pretty good job security as long as you do your job. Why a healthcare administrator? Like I said before, the opportunity to help others daily. It's something important to me, and I would like to do that with the rest of my life. I wanna live my life like that. I want to help people. Along with that, though, as some of you may know, the healthcare in the United States right now is not good at all. And to me, that's exciting because I get to go in there and I get to try to make a difference. I can give it my crack at changing things for the better. And some of the problems that are going on in this industry right now is patient dumping, and that sounds exactly like what it is. Hospitals can't take care of patients. They don't have either the money, the room, or the resources to take care of these people. And there was a woman in Baltimore that got patient dumped, and she was out on the streets, and a man was lucky enough to walk by and decided to help her, along with filming this so that the world could see the problems with the healthcare industry firsthand. And luckily, this woman is okay now. She's doing great. But that needs to stop. As a healthcare professional, I don't know how you can live with yourself after you decide to send an elderly woman out on the streets without getting the proper care that she needs, because healthcare is a right, not a privilege. Everybody deserves it, plain and simple. Another problem with the healthcare industry is there is a Native American tribe out in Arizona, out in western Arizona, and they do not have running water in that part of the country. And this is during this global pandemic, and you would think that it wouldn't be that big of a deal, but it really is. You take some of these things for granted, and one of those being is running water. You don't know how many times a day you really use it because it's been there since you were born. These people don't have running water to take showers, brush their teeth, wash their hands, and that's a very important thing during a global pandemic. You need to stay clean. You need to be properly hygiene during a time like this. It's important. There have been signs of coronavirus spikes in these areas, and people are dying from this. It can't happen. As a healthcare professional, you need to do everything you can to make everybody in the United States and in the world as healthy as they can be, because that's part of your job, as hard as it sounds, but it's part of your job. Another reason I want to be a part of this healthcare administration job is you have room to decide what kind of thing that you would like to do, and politics plays a big role in that, and private healthcare systems versus government healthcare systems. So in other countries, they mostly revolve around government healthcare systems, which is the better way to go, regardless of whether or not you're a Republican or a Democrat. It's plain and simply put that government healthcare systems are the better way to go for the entire people of a country or a nation. The U.S. mainly revolves around a private healthcare system. So private healthcare systems are what you have here. And the Obama administration tried to switch this over, and rightfully should have. But it didn't really work out on paper or in the real world as it did on paper. So in Australia, they run through a government first healthcare system. And in the United States, they run privately. So for the best example I can use of this is when a government healthcare system is first, drugs are cheaper. You can get the drugs that you need to survive cheaper. So in Australia, a twin pack of EpiPens runs about $35, while in the US, they're about $650. And the reason for that is because private healthcare systems can't buy drugs in bulk, while government, they can do that. And that's one of the main things. The benefits of the job are, you work with healthcare professionals on a daily basis. How cool is that? You get to see firsthand how these doctors and nurses are making the world a better place. You get good healthcare, which is very important in today's day and age. I don't know how you can't live without it, really. And the salaries are very good. It's your basic 9 to 5, but you get to do everything that in the healthcare industry. You get to work with everybody in the healthcare industry. It's a surreal thing. Another reason that healthcare administration is so important is you have the ability to build a hospital through personnel. And looking back at it, that's one of the main things that Children's Hospital in Cincinnati does. They were ranked third for a long time there, and I don't know what they're at now, but in all the reviews, and I have a sister that's been in and out of the Cincinnati Children's Hospital, and I just remember my mom coming home and preaching about how good the nurses and the doctors were with her, and that it all comes back to healthcare administrators hiring the right people, the right personnel, and I don't want to say that it's all them, because the doctors and nurses play a huge role in that, but the healthcare administrators are the ones that hired those doctors and nurses. And you hire everybody that works at that hospital. So you'll hire doctors, nurses, janitors, front desk workers, everybody. So what does a healthcare administrator do? A healthcare administrator runs the day-to-day style and operations of a hospital. And that's really an important thing. And it doesn't even just have to be hospitals. It can be the general care community hospitals. It can be rehabilitation facilities. It can be group medical practices. And group medical practices are like where you would take your kid if he was sick. So like pediatricians and stuff like that. It can be outpatient care locations or hospices. Major job duties and responsibilities of healthcare administrators are to plan the budgets and set rates for health services. You can assist doctors in teaching hospitals. And a teaching hospital is like the UC Medical Center. So I'm from Cincinnati, so I'm throwing a lot of Cincinnati native hospitals and examples in there. But so, and then you can develop plans and programs for scientific research, which is super exciting because I mean, stem cell research, for an example. I mean, there's so much we don't know about that, and it helps people all the time. There's so many stories of people getting stem cell research done, and it can cure cancer. You can do just about anything with it, and it's really amazing. Also, communications for the hospitals, so that's where this class comes in. You have to be able to communicate with the hospitals, the nurses, the doctors, the patients, the families, other hospitals. It's really awesome. And then you act as a liaison for meetings and stuff. In the grand scheme of things, what a healthcare administrator is in a nutshell is running the day-to-day of a hospital. And that's really important because hospitals, they're constantly busy. They're always buzzing. They're never going to stop being busy. So, and it's a dream of mine to work with people and help people, and it's really awesome. And that's really what it is. And I think that if you can live your life doing what you love, then you have won. And that's what I look forward to doing. So I thank you for your time and listening, and I look forward to some feedback. So thank you.